good evening and one warm welcome to you all. PG orientation program for Department of Pediatrics. This is the first lecture. Actually, because of COVID, the things has been reshuffled. Initially, we were having resident in the month of May, June. Now, because of this late admission and all these things, the process and month has been reset. So we were waiting all the 5 students to join the department. I think you were the last, Dr. Anjana. So thereafter, I told to our team, let us do some PG orientation program. It is our local departmental program. Of course, there will be a separate PG orientation program of all PGs of all the department, which will be organized centrally by our Government Medical College, Surgery Hospital, Bhavnagar. The idea came into my mind that when I took my admission, that is 12th March 2001, we were blank and blind. We were not knowing anything that what to do, where to go, how pediatric department is working, how is the BJ Medical College, Ahmedabad, from where I did my UG and PG. So, first 3 months are very crucial for any newly joined PG students. Lots of questions will be there in your mind, especially the people who are coming out of Gujarat. I think this time 2 people are from Gujarat and 3 people are from out of Gujarat. So how will be the department? What will be the clinical exposures? What will be the working hours? How much will be the workload? Departmental environment कैसा होगा? Right? छुट्टियाँ मिलेगी कि नहीं? हम जिस रीजन से आते हैं तो उसका खाना हमें वहाँ मिलेगा कि नहीं? सीनियर हमारे कैसे होंगे? कोई टॉक्सिसिटी या टॉर्चरिंग तो होगा कि नहीं? Right? How will be the exposure after 2 or 3 years once you will clear your postgraduate? Whether I will be able to become a good pediatrician or not. So many questions flooded in your mind before you have joined. Still it will be going on because you are passing through that sensitive phase. So I thought we should try to minimize your queries going on in the mind and minimize your level of stress. Because I am not blaming, but I have passed through very much stressful situation during my residency. So I have seen the pediatrics very closely from the 3rd MBBS student till the head of the department of pediatrics. So I know the extreme of pediatric subject with lots of changes has occurred in past 2 decades. So our aim is to give you the orientation regarding how your curriculum as a postgraduate student will go in this department. So we warmly welcome all newly joined residents in our department of pediatrics. All photos are looking nice. Very good editing done by Dr. Hinal, Dr. Nikul Puja, Dr. Umang Patel, Dr. Ankita Pawar, Dr. Nandini Pandey, and Dr. Anjana Nair. Yes, we warmly welcome you. And of course, we have seen the blend of hospitality in recent past with our ongoing UG exams. So you might have a little bit idea how the department environment it is. Might be somebody will be feeling also like that. Oh, is it true? Will it be sustained or it is a temporary? ऐसे भी कुछ question mind में होगी. Right? Moving ahead. Usually I told, I think to all of you, the people from Gujarat and others, mostly those who want to do the pediatrics but not getting based on your local state rank or all India rank. But those who want to do pediatrics are coming to Bhavnagar. Bhavnagar is never taken by a choice. Bhavnagar is given by the centralized PG admission committee, if I am not wrong. Right? But I assure you, being a head of the department, along with this team, that we will give you the best nurturing and exposure in the post-graduation curriculum because we have that excellent team, good workload, very good organized PG teaching schedules, which probably if you ask, go back 5 years, I took the charge of HOD in 2019, the things were a little bit disorganized. With help of all, we have overcome those hurdles and now we are working in a very meticulous and organized way. And thanks to these all people. Dr. Hinal is here, she is our own student and working almost post-PG, this is 3rd year. she will be also feeling a little bit jealousy. Many times she expressed, sometimes she do not express, but I can read out her face. You are privileged that you are getting the best exposure, which they have not received during their post-graduation days in the same department. Barabar, Inalke? Right. Bhavnagar, there are 33 districts in Gujarat. Bhavnagar is one of them. And there are 6 municipal corporations, 6 major districts. Bhavnagar is one of that district. If you go back to the history of royal dynasty, the Sardar Vallabhbhai Patel, who have made the United India by merging 582 separate kingdoms as a one, where you can see the Statue of Unity, which is at Kevadia Colony, Ekta Nagar. Our king, respected Maharaja Krishna Kumar Singh, was the first emperor who have surrendered the kingdom to Sardar Vallabhbhai Patel. So this is a royal land and dynasty of Bhavnagar. Bhavnagar ની ખમીરવંતી ધરતી છે. ઘણી બધી history જોડાયેલી છે. If you go back to the history, very people are there in each and every sector who have reached to the peak level in every sector. So this is a powerful land, and I mean it in a real sense. It is not just to exaggerate the Bhavnagar. Ours is the government medical college. In Bhavnagar, there are 10 talukas, which we are catering the drainage. Along with Bhavnagar, here we are having the patient from 3 districts, mainly Amreli, which is in the near vicinity, and another is Botad. એટલે ભાવનગર પ્રોપર એના 10 તાલુકા અને બોટાદ અમરેલી જિલ્લાના પેશન્ટ પણ આપણા પીડિયાટ્રિક્સ ડિપાર્ટમેન્ટમાં આવે છે. The establishment of Bhavnagar Medical College was in 1995, right? And it was my admission years. To me also it was confusion that whether I should put Bhavnagar first batch or I should go to BJMC, but finally I went to BJMC. So long way, it is a long legacy established, which is carried forward by dynamic team of our respected Dean Sir, Dr. Sushil Jha Sir, and Medical Superintendent. As I said, it's Government Medical College Bhavnagar, affiliated with Surti General Hospital. Bhavnagar Surti Hospital નું નામ એટલું સ્ટ્રોંગ છે કે ઘણી વખત પાલિતાણાનો પેશન્ટને આવે તો કે અમે પાલિતાણાના સર્ટીમાં ગયા હતા. Surti has become the synonyms or prototype of a medical college everywhere. Like you recall, biscuit is Parle, Cadbury is like chocolate, toothpaste is like Colgate. Every government institute people are misnomerly using the Surti Hospital, right? And university is Maharaja Krishna Kumar University, Bhavnagar. This is affiliated. Why I want to mention the university? Because if you go abroad, I don't know what is the plan of future after MBBS, after MD you might go for fellowship, or someone can think to settle down in abroad in UK, Australia, Canada, USA. Mostly people prefer Singapore. Then they recognize the university. They, after your application, they Google from which university you are. Then comes the college, and then they will see the hospital, and fourth there will be a role of department. But proudly, if you see and ask anyone, those who have, till now we have passed more than 90 students from 2006 till date 2025. Our students are working in Bhavnagar, in Gujarat, out of Gujarat and out of India, and all are thriving well. And we consider that it is a reflection of the one of the benchmark success of our pediatric department. Here we have 200 MBBS seats per year and 120 PG seats. Probably I think it has increased. Just verify 132 or 138. In pediatric department we have 4 MD and 1 diploma. So total 5 PG admissions per year. In your batch who is from diploma? Acha, Umar. Rest all are from MD. Mostly this year also now NMC, National Medical Commission, which was previously named as Medical Council of India, who is our central organizing authorized body. So we are planning to surrender our seats of DCH or planning to convert the one DCH to MD, because in most of the states of India now diploma is converted into the MD. If we see the ranking, there are 1,131 universities in the world, and Bhavnagar ranks 5,594. In Asia, 2049. In Gujarat, I would say the ranking of university is 17 out of total 67 university, which includes government university, private university, and deemed university. Right? Thank you, sir. Lecture. Take message. And there is one survey, various surveys are ongoing. If you Google it, right? What is the rank? I think you people have also searched कि भावनगर यूनिवर्सिटी का क्या rank है. So Times of India survey in 2019 says among the total universities you can consider 876, right? Bhavnagar, our Krishna Kumar University is ranking 58. So you can see the credential of the university is very good. Where apart from the medical field, lots of other courses are also ongoing. The vision and mission of the department is quality care for the patient, quality care for the staff, quality care for the team. We want to produce the best pediatrician, so you can thrive well after your post-graduation course. Right? I have seen the trend that many people are joining some short fellowship or DM course. That is very fine for your personal interest. But we see to that there should be no any knowledge and skill gap where after passing your post-graduation of pediatrics from Bhavnagar, you should go here and there to gather the knowledge. कि ये नहीं आता है कि आ नहीं आवड़તું सेंट्रल लाइन નાખવાની રહી ગઈ બરાબર આઈસીડી પ્લેસમેન્ટ નથી આવડતું પેરિટોનિયલ ડાયાલિસિસ કરવા માટે કેથેટર પ્લેસમેન્ટ નથી ખબર. So we are giving the free hands. Mostly all the procedures are being done here, and your seniors will guide you that how to go ahead. Right? So it will be a quality care. And the education, right? What is the difference between knowledge and skill? If you read the theory, get some concept, it is a knowledge. Once that knowledge you apply practically in the benefit of patient, that is called skill. So you have to become a knowledgeable pediatrician as well as skillful pediatrician. And during all these journeys, you have to pass through the process of education, which includes your research methodology, which includes your theory. After reading, like if a patient of GBS came, then you have to read once your work is over, and then next day you have to discuss with your colleagues, ask for some queries with your seniors, mentors and faculties during the round, and then you have to apply that knowledge in the experimental phase regarding the treatment. Like somebody senior told me, "Ana plasmapheresis karvanu." Then you have to find out what is plasmapheresis, how it will be applied for the case of Guillain-Barré syndrome, right? So all the things will be go one to one. During that, lots of questions. કે plasmapheresis machine ક્યાં હોય, કયા ડિપાર્ટમેન્ટમાં થાય, કેટલા સમયમાં થાય, so many questions. In questions you will ask, somebody will answer you rightly, somebody will answer you wrongly, somebody will answer you overconfidently, but you have to make some filter and turning and apply those crux for the final benefit of the patient. Right? This is the galaxy of our pediatric department. All are looking very nice. I think this is a recent photograph of farewell of our post-graduation student who has recently passed, Dr. Jay Kaklokar, I think Dr. Manali, Dr. Nitisha and Dr. Ravi. So this is one of the important events of the year where we have a nice celebration and gathering with dinner of our all PG passing students. Every year we have these events probably. This is the galaxy of our faculty, starting from myself as the head of the department. I took the charge in 2019. In fact, Alpa madam is senior most, but as per the cadre, Alpa very senior to me also. But as per the GPSC and DPC seniority, I am holding the charge of HOD as per the government rules. Sometimes you might feel कि मैडम सीनियर है तो सर कैसे HOD बनेंगे, ऐसा क्वेश्चन किसी को होता है. So this is the logical answer. Madam, Alpa madam, she is the head of unit 2. Dr. Arvind Pucha sir, he is head of unit 3, which is neonatal unit probably. I think who is posted in unit 3 right now? Ankita and Nandini. Who is in unit 1? Achha. Umang and Anjana. And unit 2? Nikul. Right? And we have a very blended, different, discrete, mixed bag variations of the faculties, eminent faculties of the city, you can say, starting from the senior most person. In fact, Dr. Kamlesh Uradkar sir is most senior among all. Who is our assistant professor, Dr. Chandan Narwani, who is allergy specialist, Dr. Shipra Agarwal, is a critical care specialist, our own student of Bhavnagar UG, thereafter she went for PG, Dr. Hardev Singh Mori, Dr. Mehul Patel again critical care specialist, Dr. Dimple Sidrani who has done specialization in lactation management. So, and one more person I think is missing, Dr. Anand Gogawal, who is our pediatric echocardiographer. So, you will have a different kind of exposure. Each and every one are unique. सभी के पास कुछ न कुछ अलग सीखने को मिलेगा, right? On a lighter note, I would say this is a department where you have two kind of exposure. क्या करना है वो भी आएगा और किसी से क्या नहीं करना है वो भी आपको आएगा. But for that you have to use your wisdom, right? So this is faculty. This is again our external department senior resident Dr. Hinal, holding the charge of both unit 1 and 2, Dr. Aradhna in NICU, junior resident Dr. Ravi, Dr. Farnas, Dr. Nitisha, Dr. Manali, Dr. Gaurav and Dr. Parita. And the most happiest people I would say, Dr. Payal, Dr. Zain, Dr. Nikunj, Dr. Nikita and Priyanka. Most happiest because they were waiting for you like anything. Right? CPS we have posting, but at present no one is posted from the CPS. Medical officer only, we have 4 medical officers in NICU, Dr. Sangeeta, Dr. Sahil, Dr. Hemal and Dr. Jenny. Right? So this is the galaxy of our department. All are very nice, cooperative, supportive. Right? Hardly we have not kept any kind of barriers or you can get any kind of stress level from your seniors. Right? So, moving ahead, staff in charge. This is another group where you need to interact every day. Right? Still I remember many a times after I think leaving BJMC in 2005 or 6, 20 years, my nursing heads and nursing staff called me. Some of you might be knowing this. So that is the best rapport I created with my nursing staff. So here in unit 1, Devika sister is sister in charge. In unit 2, there is Asha Ben, NICU is Sushila Ben, and in OPD and vaccination Hina Ben. These all are the nursing heads. Where frequently you need to interact with them. Of course, along with the other staff, we have almost a team of 47 nursing staff in NICU, 13 nursing staff in Unit 1 and 13 nursing staff in Unit 2. Along with this, we have a backup of Class 4 and Group D staff. We have clerical staff Pankaj by here. We have whole team of DIC differently working under the leadership of Dr. Kajal Ben. We have whole team of NRC, Nutrition Rehabilitation Center. It is working under the leadership of Rachna Ben Sheth and Dr. Alpa Madam. So it is a subsections of pediatric department working very nicely. Same way the NICU is with the gynec department working under the leadership of Dr. Arvind Pujas. So nursings are equally important. I wish and suggest you that make a good rapport with them because I consider 50% important role of nursing staff in management of any patient. 50% doctor, 50% nursing staff. So create a good rapport, healthy rapport, respected rapport. This is my suggestions to all new coming students. Department infrastructure, if I talk, there is OPD, the blessing in disguise. There was one new building which was declared with some risky infrastructure, so we have to shift this. This is an old ancient heritage infrastructure which is very strong. So now we have everything in under one roof. You can say blessing in disguise. सभी जगह पे एक ही चीज एक ही वार्ड में सब मिलता है, राइट? तो इधर उधर नहीं जाना पड़ेगा. So OPD is here. You people have visited and you are doing daily. IPD indoor is also here. Unit 1, Unit 2 upstairs. NICU is different, just nearby in the vicinity in Gopinath Maternity Home. Especially those who are newcomers. I think Umang and Nikul are well oriented now, right? Pediatrics ward BM1, right? BM2. BM is maybe medical ward. It is old name B1. So we in Bhavnagar we call BM1. It is not a standard abbreviation, right? Sometimes people write BMW1, right? So it's a misnomer. Our is a medical college related hospital, so 24/7 working ward, NICU, PICU, all these things. So we work in the rotation. We do have specialty clinic at present. Is DEIC is functioning well, District Early Intervention and Rehabilitation Center, NRC Nutritional Rehabilitation Center, and Adolescent Clinic, AFHRC, Adolescent Friendly Health Resource Center, which is in the Gopinath Maternity Hall with the gynec department. So at present, these three clinics are there. Our vision, I will declare in the later stage. Also, we want to expand this pediatric subspecialty clinic. Here, if you see, there is some benchmark written, and I niche પણ લખ્યું છે. You read it, where you can see that how much old this structure is. It was at the time of, I think, Queen Britishers time. I have forgotten the name.
1859.
So this is a long history and good structure and infrastructure. You feel like a heritage building, but the culture is heritage, building is heritage, and royal as well as the exposure of PG is also royal and heritage. This is our pediatrics OPD. It was actually war, but after shifting that, we have converted into OPD due to space constraint. Beside this, there is a clinical room where the UG classes is being done regularly. PG classes is done here in the seminar room. Probably Dr. Hinal forgot to put up the photograph of this seminar room. It is the heart of the department, I can say. This is the room. Majority of the administrative work we are carried with our team here in the department. Vaccination clinic we have separately. As per the NMC norms of postgraduate curriculum, we have sufficient compliance in each and every sector. This is our PICU. PICU is at both upstairs and downstairs. This is our NICU. We have almost more than 10 beds in PICU with more than 15 working pediatric ventilators of good quality. Right? I think from Drager's it is there set. Right? Schiller's ventilator. So good quality of pediatric ventilator available. In NICU also high-end equipments. Right? With high frequency, regular conventional ventilation, airbo, CPAP machine. So almost you can say we have 15 bedded NICU including the KMC room, where level 2B or 3A category of care is being delivered. So NICU exposure is wonderful, sufficient workload. NRC in upstairs in corner, nutritional rehabilitation center where malnutrition patients, severe acute malnutrition patients are being specifically getting admitted and treated with the proper guidelines. DEIC's District Early Intervention Center where specific children with disease, deficiency, defect and disability, 4 Ds. Now it is a new concept of Ministry of Health and Family Welfare of India as well as, and it is applied in every medical college in Gujarat. So here such kind of cases is taken care specifically by our specially appointed team by Dr. Kajal Purohit Madam, Dr. Chaya Kansuria and the team. So it is also a separate team working with the department. Academic activity of the PGs. This was my, I think, dream project which I have incorporated, which was missing at the time of Dr. Hinal. We have almost 8 to 12 activities per month for PGs. Right? Sometimes because of some mixing schedule, overlapping schedule, exam, some camps, we missed 1 or 2. But by and large, 70 to 80% we try to abide this. So all PG students has different kind of PG activity they have to perform. 12 activities, so 4 activities, 4 academics activity in a week for the PG students. You have been mentored by one senior resident and one faculty or teachers. And it is a mixing blend. This you can see a very good discussion going on in the same room. Right? Dr. Parita is visible, Dr. Zain is visible. Yes, Dr. Dimple Madam is there. So it is a good discussion. Good academic churning is being done throughout the month, and we release the schedule in probably first or second day of the month. So you can have orientation and idea that which student has to do what. And that if you see that it includes seminars, it includes case presentation, it includes video on any pediatric procedures, it includes the approach and guidelines, it again seminar, it includes journal clubs, it includes faculty lectures that we have started recently, that also includes online PG session by IAP and NNF. Neonatal Pathshala and Gurukul is going on Wednesday and Tuesday probably. So here there is an internet connection, so we have organized that at least that 1 hour session will be attended by the PGs, which is organized by Central IAP and NNF. Right? Still we want to include the 2 things. I don't know from where we will be able to apply, but 1 guest lectures. So it will be pediatric subspecialty or other specialties like role of physiotherapy in pediatric patient management. We will invite some pediatric physiotherapists. Role of pediatric surgeons in collaboration with pediatric department. We will invite pediatric surgeons like that. So we are planning to do that, and one non-medical lectures, right? कितना भी पढ़ लिया पूरे दिन 3 साल पढ़ना pediatrics. Sometimes we get hang. We forget the other things. Like we become like an alien or robot. So we have to think out of the pediatrics. So we are planning to keep some non-medical lectures like stress management, work-life balance, financial management. Of course, now the stipend is good in Gujarat, almost around 1 lakh. So all are the rich generation. Which generation? Zen.
Gen
Z generation. You all are Gen Z, rich generation. Because our times, hardly in PG the stipend was around 6,500, like that. You are almost having more than 1 lakh. So financial management, so many things we will try to incorporate. Let me see how I can manage along with the support of my team. But it will be a good exposure throughout the PG, right? So you will be expert and master once you are out of this. Actually, this we want to also implement in the GRIP Summit, right? GRIP Summit is good, replicable, innovative practices. Every day, SHSRC Gujarat, Gandhinagar is organizing, and the best practices across the state is being taken up. Last year, we have published our neonatal care practices, and Bhavnagar Medical College NICU is one of the best NICU among 58 NICUs in Gujarat, with the least mortality rate of 5.67%. So probably I am sure you can interact and cross-verify. It is not like that what HOD sir is saying it is true, right? But you can cross-verify. But this type of program is very unique in Bhavnagar, in PG. Still one point is missing. Still I don't know why these people like Zain and Dr. Hinal and Nikunj has not implemented. I told them one movie club, some message giving movie, at least once in a month, one Sunday. This is a good smart board, audio visuals, sound system is there. Like if you see Chak De India, wonderful movie. How many of you have hobbies to see the movie? Okay. Almost all. So utilize that. Bookworm banwanu nathi. So at least once in a month you incorporate. I have given the name of movie also, like Gandhi My Father, which is on the Alzheimer's disease. If you see the Hitchkey of Rani Mukherjee, it is typically on Gillis-Dola syndrome. So many good movies are there, right? The old movie like Ek Ruka Hua Faisla, which is on the group discussion, black and white movie. So at least organize 1, 2 or 3 hours movie session once in a month, movie club, which is probably there in
psychiatry department.
Yeah. But they are going outside. We have our own facility. Why can we not utilize it? And one, still I want to add one, this is book reading. Book, right? First you will come, then senior will tell, in UG, Suraj Gupta or OP Guy. Like in PG, you will read Nelson's. Some will read, UK people will read Arnills and Korpar, right? In NICU you will read Glohartis. Some Gujarati lovers and Indian lovers like me will read Meherban. So many books are there. Right? So you should have also keep in further session regarding the orientation and PG also. At least week edition is there, soft copy is available over there, online access is available over there. What is the cost of the particular books? So that will be helpful to them. Right? So this is a wonderful, I think, program which will be given to all of you, including one they are missing BCBR session, basic course in biomedical research, which is nowadays compulsory for all PGs. Right? Clinical responsibilities, where you have to appear into the clinical rounds, where there is a case management discussion, procedure discussion by your senior resident, junior resident, by the faculties and all this. You have to also sit into the OPDs as per the given schedule. Every monthly on the last week or first week we release the schedule accordingly. You have to rotate into the posting like Unit 1, Unit 2, NICU, and adjust the OPD accordingly. And these people will make you orientation that how and what terms you have to attend the OPD. In same way for the emergency duty shift wise, NICU duty shift wise. Coordination with other department, which is much important. Still we are doing good, but we want to go with the best coordination, which will of course benefit to you for enhancing your skill of interdepartmental coordination, as well as make you the better communicators, and ultimately it will be useful for our patients. Right? Practical approach to deal with the patient and the relatives, which is very, very important nowadays. The things have been changed in last 2 decades. The residency days of mine in the Ahmedabad, residency days of yours in Bhavnagar or Gujarat or anywhere are totally different. At our time, the respect of doctors was much, much higher. Here now the respect is diluted somewhere because of one or another reason. Patients are furious. Easily you have seen lots of news regarding the assaults on doctors because of small and trivial reason. And that is why you have to learn the practical approach to deal with the patient and their relatives. Probably today only we are dealing with one of the difficult relatives, I think Parnas knows, and we are managing it. So here you will have that learning also. Learning beyond the textbook. How to deal with the difficult patients and their relatives. Right? With cool and calm mind, without losing your temperaments, with proper sympathetic and empathetic approach. And that you will learn gradually as you grow older with your seniority. Right? Good morning. Greets. This is most of the time missing. And if you appear for USMLE part 1, 2, 3 or player, this is very important. They have checklist. If you have not greeted to your patients and started immediately history taking with the informants, blah blah blah, in India and in Gujarat it is acceptable, in Western world it is not acceptable. So greet to the patients, relatives, greet to your seniors, greet to your faculties. Once at least, once, not every time. No need to greet every time, good morning, good afternoon, sir, madam, didi, blah blah. But once, first you meet at any time. So greet is very important. It is a respectful, humble gestures. Rapport building, that is an art which cannot be taught or cannot be acquired by reading the books or seeing the YouTube videos. Only once you do practice, follow your seniors as our faculties, then you will imbibe these qualities in yourself, that how to build up the rapport with the patient, because it is very, very important to establish and build up the rapport. And I am very happy that many of our doctors who are sitting here are expert. કે એવું નથી કે ભાઈ મેહુલ સરને બતાવું છે, કે અમારે જૈનભાઈને બતાવું છે, અમારા હિનલબેનને બતાવું છે, અમારા નિકુંજભાઈને બતાવું છે, અમારા પરિતાબેનને બતાવું છે, બરાબર, અમારા પરનાજબેનને બતાવું છે. What it suggests? Rapport building. So many steps, we are not going in detail, but it is very, very essential. Patients, relatives should put trust on you that my child, my newborn is safe in the hand of his doctors. Right? So that is called the rapport building. That trust will help you further to proceed during the whole course of management of this child, whether it is a basic management, whether it is a PICU management, whether it is a critical management or NICU management. You should be a good listener sometimes, right? So that quality you have to learn from the many seniors, excluding myself and Dr. Hinal. A good listener is a good quality. Sometimes at least relatives should feel that doctor is listening to me, right? Even if your attention is somewhere different, your mind is thinking something different. Physically you are present here, mentally you are present somewhere else. The relatives are very smart, even though they are illiterate or uneducated. They can make out that this doctor is sitting in front of me, talking, but his or her mind is diverted somewhere else. My ticket is not confirmed. Or whether I will get, when I will get the leave of now after joining the residency to go to home or somewhere else. So be 100% present physically and mentally when you are dealing with your patient, you are doing the counseling. Probably we have a good counseling sessions 3 to 5 in NICU. I have also made the rules. Circular will be there. We are also in the department for pediatric patients. We are starting counseling between 3 to 5 in our OPD rooms. So counseling is the part where it will differ, it will make you different from others. And that will be your strongest point, which qualities all of you have acquired. Yeah. And these people, I'm not exaggerating myself, but I can say the ATCOM which we are teaching in UG, so I am a good counselor. Sometimes you bring your patient, listen how I am dealing and talking with the patient relatives. So without the classes, you will learn how to do the counseling. Barabar, Parnas? Every patient, when patient came, start with the greets. You have to go with the detailed history taking. Don't make any cut short in history taking. Though your senior guides, કે આમાં આવું કરના કામ. આમાં બહુ કોઈ જોતા નથી સાહેબ. એવું નહીં કરવાનું. Don't do that. Go with the detailed history taking because your exposures and UGs are from different college. Can you tell me your UGs?
So, GMARF Valsad.
Valsad. Umang is from Valsad. Nikul?
Gujarat Institute Coach.
Adani, Bhuj. Okay. Nandini?
Government Medical College, Jhalawad, Rajasthan.
Rajasthan, Jhalawad, Government Medical. Ankita?
So Government Medical College, Nahan and Himachal Pradesh, same college.
Government Medical College, Himachal Pradesh. Okay, great. Anjana? GMARS Sola Ahmedabad. Okay. So we don't know what is your UG exposure, how the pediatric subject you have been taught by your mentors or teacher or department, how many questions you have done, we are having no idea. But here you have to learn in a very much organized way with the detailed history taking, thorough clinical examinations. After that, you can have ideas of possible differential diagnosis, and accordingly, you will offer several specific relevant investigations directed by your seniors, SRs, faculties, and colleagues. After that, with available investigation within a day or two, you will reach to the nearest possible clinical diagnosis, confirm with the other parameters of laboratories and radiological aspects, and then you can start the treatment. Initially, it will be a standard empirical therapy followed by precise and definitive therapy. Guidelines. Everywhere there is one Gita, Quran, Bibles, authoritative. So we follow the different guidelines. We don't go haphazard because this is an era of evidence-based medicine. If anyone you don't know, then read what is evidence-based medicine. There are two schools of thoughts, USA school and UK school. But in both the concept is same. You cannot do haphazard jugglery, what I likes to do this or what he or she likes. Everything which is evidence-based, scientifically proven, can be given to the patients according to the particular guideline. From international level to the national and state level, we follow WHO guideline, we follow ICMR guideline. Sometimes we also read the CDC website. Yes, website review is also one of the part of our PG schedule which probably you have missed. Right? Indian Academy of Pediatrics, lots of good guidelines for parents as well as PGs. We do it. NNS guidelines, National Neonatology Forum guidelines. STG by Government of India and Gujarat Standard Treatment Guideline. Our students follow the AIMS protocols for NICU and PICU. As a standard textbook in PG, you are suggested to read Nelson's. For practical, the people are reading Santosh Kumar. You might be reading UG books like Mayor Cheda, NC Joshi, ML Kulkarni, Part 1, 2, 3. Many books are available. But according to your choice and readability, speed and space, you can utilize it. Almost, I have read a few chapters from all the books. K. Elizabeth for the nutrition, right? Illingworth is also there for growth and development. So many books are there. So senior will guide you further in further lectures. Right? Prognosis and counseling. Breaking the bad news. If you have appeared for OSCE, then there is one specific patient. 8-year female child presented with severe anemia, lethargy. Parents brought the child. Patient's report has been sent. HP is 2 gram. WBC count is 56,000. PS was suggestive of blast cells. The diagnosis is leukemia. Now call the patient's relatives and how you will counsel that your child is having blood cancer. This is, and what is the prognosis? So this is the art which you have to develop during your residency. If the leukemia is diagnosed during your counseling session, how will you talk with the patient's relatives? How will you discuss the bad news? How will you break the bad news? તમે સીધે સીધું કોઈને એમ ન કહી દો આને બ્લડ કેન્સર છે, લોહીનું કેન્સર છે, હવે આ છોકરો નહીં જીવે મરી ગયું. No. That are the harsh words. You can never disclose or discuss like this. You should be very gentler, you should be very sympathetic, you should be very empathetic, you should be reasonably explain in a humble and most scientific way based on your experience. So all these things you will learn to the process. Interdepartmental collaboration. This is very important. We need the help of pathology and blood bank for blood transfusion, for histopathology report, for biopsy, for bone marrow. We need microbiology help for culture sensitivity, pre and post fumigation, swabbing, and antimicrobiogram. We also need microbiology department for antimicrobial stewardship program, biochemistry for certain departments, surgical collaboration is required for few surgeries which has been performed here in our institute also. Still we don't have pediatric surgeon, but our surgery department is good. They are performing few surgeries. ENT department for foreign bodies, right? Ophthalmic department for ROT screening, orthopedic department for some traumas and injuries. We also call the neurophysician and neurosurgeon in case of CNS cases. So interdepartmental collaboration is very, very important, and you have to learn throughout your residency. We also have collaboration with medicine department if patient is between 10 to 18 years of adolescent group for dialysis and all those stuff. Some cases of thalassemia, when they grow in the age at 14 years, they are reluctant to go to medicine department. So wisely we have to counsel them. At present we are taking care of the patients from neonatal age, they 1 to 12 years, right, in pediatrics. We should also greet and congratulate the patients on discharge, which probably the new culture we should imbibe and start. There is one important thing, I think you forgot to add the slide of Code Krishna. The people from Karam very touchy rituals which personally I like. On the expiry in every death, they do some small rituals from any XYZ community patients, Hindu, Muslim, Christian, Sikh, anything. They put the flowers, give prayers and the tribute. That is called Code Krishna. I am sure with Dr. Aradhana is not here today, she is our SR. With the help of her, earliest we can start Code Krishna. And on sad part also, as well as to congratulate. I think that will be a good rituals of our department. Explain the detail about follow-up plan. Probably senior will teach you that આગલા દિવસે સિક્યુર મારી દેવાના, આગલા દિવસે કાર્ડ ભરી રાખવાના, તારીખો નહીં મારવાની. ડાયગ્નોસિસ ગમે તેવું હોય, બરાબર છેલ્લા દિવસે ડેટે ભરવાના. એવું ના કરતા. Because now PM Deva Yojana is there, don't do the shortcut. Fill the card meticulously with precise detail, get verified by your R3 or SR. Explain them the proper discharge plan, proper follow-up plan of all indoor patients who is admitted, whether in NICU, PICU or both. Right? So many times we have found some fallacies recently, like in thalassemia, don't do that. So this is also very important. It will not take more than 1 or 2 minutes or maximum 5 minutes. But patients' satisfaction is very important. They will go happily with satisfaction without any confusion in the mind. Work with multidisciplinary approach and never delay to refer. Multidisciplinary approach. Probably this is very important qualities you have to learn in the pediatric department during your residency. Single person, solo person cannot do anything. Either myself or anyone. It is a teamwork where you can get the best result and output. So try to fit in yourself. Because nature of everyone is different. Somebody feels happy alone. Somebody feels happy in the crowd. But when you are a doctor, train your mind or format your mind and try to learn, become a social. Without socialization, you cannot become a good doctor. Without multidisciplinary approach, you cannot become a good doctor. So this is also the command you have to give to your mind. Application NLP. How many of you know NLP? Neuro linguistic programming. New words say Google karjo, YouTube ma mali jase. I am not going into the detail, but those people who are facing the problems of adjustment or anger or teamwork or many things, you can transform yourself by practicing this NLP, neuro linguistic programming. If the time permit, we will call some expert here in the department to deliver the lecture on NLP. Right? It is really wonderful thing. You can do it. But try to fit yourself in a team. Work as a team. Maintain the respect of everyone. Maintain the hierarchy. Don't try to bypass anyone. Like R1 will follow to R2, R2 to R3, R3 to SR, SR to faculty, AP, AP to associate, associate to professor, AP. This is the hierarchy which should be maintained and respected by each and everyone. Yes, in initial phase for first 3 to 6 months, any mistakes or blunder is acceptable. No one here is perfect, including myself also. But try to learn from your blunders and mistakes and take the take-home message and conclusion that don't repeat that mistake. Every mistake will be an opportunity for you to become strong, to learn something new. Talk to the relatives as we have discussed with cool and calm mind without frustration. Right? Nobody came here in the hospital to do the excursions. They are in the stressful situation because of ill health of their beloved child. That's why they are coming. So your counseling, your mindset, your approach to the patient's relative, mostly in our case, they are the parents or grandparents. Because here the culture is different. In government medical college, patients are maximum coming from lower and lower middle socio-economic class. So it's a different class. Many we do have upper middle or upper class. So every class you have to understand their mindset, their expectations, your counseling language, your counseling skill and approach should be different. But one suggestion before you talk, at least try to know their education level and their occupational and professional level before you start your counseling, right? Because I remember the incidents of my round. We were talking regarding there was query between tuberculoma and neurocysticercosis. So Dr. Rajshri Mehta and Sheena, I remember the corner court during my rounds. After our conversation, the simple looking mother in the Gujju style started to speak in English and told that, doctor, I know English, I am English graduate. So whatever conversation has been done among you, I can understand each and everything. That was shocked and surprising for me. એટલે હંમેશા તમે કાઉન્સેલિંગ કરો એ પહેલા માતા પિતાનું એજ્યુકેશન અને પ્રોફેશન જાણવાનો પ્રયત્ન કરજો. આ લાઈવ ઇન્સિડન્સ આપણા ડિપાર્ટમેન્ટનો છે. રાઈટ. Responsibility in further sessions day by day during these 5 days, these people teach you lot, so I am not going in much detail. It will be clinical duties, it will be academic duties, there will be research expectations, especially for PGs. Now in near future we will come with your thesis allotment. So at that time we will give you the details how to proceed in further except the diploma. But I wish that diploma also should take one research project that will be helpful to you people further go for secondary DMD or something else, right? Code of conduct and ethics, very very important to know. You have to also help into the departmental work. Recently you have seen Hinal, Dr. Zain, all our RPs have helped in examination of final MBBS. So some help in departmental work, some help in social work like going for medical care, some other duties other than the department which may help you. I think Zain should also ask for the tea because lecture and Nandini is having a nap of sleep to make and keep her awake. I do understand it is very routine in first year residency.
ઇન્સ્ટિટ્યૂટ છે ને
Yes, yes, it is very well accepted, right? Daily and weekly work schedule will be given to you for academic session, for CME program. We do a good collaboration with our IAP Bhavnagar bodies where many good CMEs is being organized every monthly. Our resident doctors enthusiastically doing participation in that. So you will have a rotation based participation. We will place you 2 times morning evening rounds by our faculties and residents and senior residents. Case discussion during this round, OPD duties, ward duty, emergency shift. In further lecture, we will explain in more detail. Statistics of the department. In ward, you can see 350 to 450 admission per month, both units. In NICU, again, we have 250 to 350 admissions per month. Sufficient workload. In NMC inspection, assessors will also see that what is your clinical teaching material and workload. So this is our statistics and data, and someone can cross-verify. We have already done it. Our workload is as per the NICU of AIMS Delhi. Same admission. So sometimes, many times I tell to my team of NICU that if they have achieved a good benchmark, why we cannot achieve, right? So you will have a good exposure of patient OPD, almost 2500 to 3000 patients per month, almost you can say 100 patients per day. DIC, again 1500 to 2000 patients per month. NRC, Nutrition Rehabilitation Center, 10 to 15 patient admission per month for severe malnutrition. And proudly I can say that our ward expiry is 2.5% only. and mostly they are critical patients admitted in PIC of unit 1 and 2. And NICU is 5.57%. This is the best proud moment for us because majority in Gujarat it is in the 2 digits, and since last 2 years with the help of our strategies, efforts, continuous monitoring, mentoring and the sincere efforts by all sitting here, we are able to maintain its single digits mortality in NICU. So I am sure and expect from all you five that you can also be a dedicated part of our team and maintain the grand legacy carried and given to you by your seniors. NMC mandations, minimum 80% attendance, you have to do one thesis for MD student, right? And upon dates and times and guidelines say, paper, poster and publications. પહેલા એવું હતું કે 3 કરવાનું હતું, એક પેપર, એક પોસ્ટર અને એક પબ્લિકેશન. As per the new rules now it has been changed. You have to do any one of these. Papers or posters or publication, any one. And in the subject specific conference, in the city or in the state or out of the state. That further these people will guide you. Basic course in biomedical research, BCBR. This is a little bit maybe raw area or you don't like it, somebody almost, but being a good doctor, it is very imperative that you should be a good knowledge of research and methodology. And now it is compulsory course, you have to do BCBR before you appear for your final PG exams. So they will guide you further. ACL and BLS course certificate, advanced life support and basic life support. Our hospital and medical college is organizing every year. You have to be a part of it, and thereafter you will get a certification. Because by putting the pediatric patients, sometimes we forget that we are also a common creature as a human being. We can have any kind of problems or health issues to us. How to manage the cardiac emergencies, sudden collapse and all these things that you will learn in ALS and BLS. If I talk about the exam pattern in MD, there are 4 papers, 1 paper of 100 marks, total 400 marks. In BCH, there will be 1 less paper, 300 marks, right? In practical exam, in MD, 1 long case, 2 short case, 1 is newborn out of 2 short case, 4 different table, and thesis viva, which also further includes OSCE and ADCOM, as per the new curriculum for PGs. So it will be 400 total, 800 marks. In previous batch, it was 1000, so 200 marks is reduced. In DCH, 1 long case, 1 short case. Probably we will give 2 short case here. In newborn
Mistake.
This is typo error.
Typo.
Please ignore it, and 4 tables. So it is 300, total 600 marks. So that will be a. Now your periodic assessment will be done in one or another way at every 6 months, but this will be your final exam pattern assessment as per the NMC. Right? And minimum passing criteria is 50%. The another good part I would like to say, in Gujarat, the Bhavnagar is the first university to do the digital assessment of theory paper, BG Mulyankan, in UG PG board, where your paper will be assessed by 2 different examiners. And if the mark variation is more than 15%, then it will be done by 3rd assessors. And after that 3 assessment, highest 2, 1 and 2, will be sum up divided by 2 average, and that mark will be adopted. So there will be a neutral assessment of your theory paper also, and there will be separate 20 marks of thesis viva. This is new, and that will be taken by the team of all examiners along the chairmanship of the exam chairman, but he should be an external examiner. So you have to also, you will appear for the thesis viva. So this will be your exam pattern by the end of your course. If I talk the future vision of our pediatric department, first is our plan is to convert the diploma seat into the degree seat, which is 1 seat. So all 5 will be MD pediatric seats. Second is to increase the PG seats, which proposal is already set. From next admission, there will be total 9 admissions. We have put up the proposal through proper channel to increase 4 PG seats according to the workload and available faculty as per the NMC criteria. So we are planning to increase the PG seats. So 5 plus 4 probably. 9 students from next admission, we hope so. Third, my vision is setting up the separate PI. So our NIC is wonderful. These people knows, you will come to know during your posting. And I think Nandini knows the way she is sleeping, looking to the workload of NIC. Right? So NICU, like PICU nearby. we have a separate, if you go outside, isolation ward. Previously it was our NRC. We want to take this back and establish separate PICU, like NICU, and dedicated team after increment of the seat, because it is a marathon task, lots of churning is required, lots of efforts is needed to establish, but I am sure within next 1 to 2 years there will be separate PICU. And the reason is after establishing separate PICU and NICU, in the collaboration with IFP and NF, we want to start 2 seats of fellowship in critical care in pediatrics as well as in neonatology. Fellowship, as I told you, for both. In short vision, in our NICU nearby in the gynec ward, we are starting CLMC, that is Comprehensive Lactation Management Center, which you like a blood bank and financial bank. It will be a milk bank, which will be shortly function, and probably it will be the first in the Saurashtra zone in government medical college. Let me see how we can do it at earlier with the support of you all. I can proudly share that last year in February only, ours is the first government medical college in Gujarat who is certified with the Muskan with 89%. Muskan is the quality assessment criteria under the NQAS program, where the team of external will, first we will do the internal assessment, then peer assessment will be there, and after submission of the report of internal and peer assessment, the team of expert came from the state and they will do the assessment of our department, and Bhavnagar is proudly having certification of Muskan with 89%. Right? So we will maintain that and probably try to achieve the national certification for Muskan also, as well as NNF accreditations. So these are our vision for NNF. And in last week also, one thing I discussed with my team, that we want to, like above this there is a physiotherapy. So above that first floor, the ward floor is open. We want to establish some recreational areas or gym into the department, because physical and mental well-being is very important part. Right? Parita is laughing on this statement, but I think it is very imperative. Many doctors are getting fall sick earlier because of workload, because of stress level, or many things. Early MI issues we are witnessing in the media and newspaper, all this. So at least science says 30-minute exercise per day, 5 days in a week. So if the recreation area is in our department, you can easily access it. That is our vision. I don't know how we can make it possible, but I am sure, I am determined with the support of you all, we will do new initiatives. Right? એટલે કે બીજું આડું જીમમાં કે એમાં ન જવું. And that will minimize one excuse to leave the department and go to the gym, and if you are going somewhere else. That is my secondary decision. Anyway, don't go fast. PG orientation by the medical college is also coming soon. Now all have joined. કોઈ round pending છે? બરાબર બધા જ વિભાગમાં? Okay. So you know which is the place? Which is this place in Bhavnagar? Very good. And a chocolate apple.
પૂછો તો કરે હું કરવા ખબર છે એમ.
This is, Bhavnagar is blessed. One side is Gauri Shankar Lake, known as Gorgala. Another side is Victoria Park. This is very unique city, where the jungle is in the center of the city, and in between there is a wonderful 5-star resort called ISKCON Club and Resort. Last year we had a state conference of IMA, very good location. You can see the glimpse and photograph. Your common PG program will be mostly conducted there, like every year. If there will be not a change. Right? Gloriously, you can see we have received the Green Summit Award at state level. Right? With the head of Dr.Mehul, Madam Commissioner and Director of NHS. We are also planning to submit our PG practice in GRIP 2025. This is 2 days before GRIP, probably yesterday. Our NRC completed 11 years. We have discharged 1,430 patients of malnutrition, and it is one of the challenging programs. And as I told, we have received 89% in the Muskan. And they will see the pediatric OPD, pediatric ward, NRC and SNC. In 4 criteria, aggregate we have received 89%. So, if you will feel the infrastructure is old, but the exposure is great. It is really wonderful. You will not have any kind of gap or lacunae as far as pediatric post-graduation is concerned. The important stakeholders, if I talk, our university's acting Vice Chancellor is Dr. M.L. Trivedi sir. Our present Dean of Bhavnagar Medical College is Professor and Head of ENT, respected Dr. Sushil Jha sir. Our additional Dean is Professor and Head of Forensic Medicine, respected Dr. Amit Parmar sir. Our dynamic superintendent, medical superintendent, my good friend Dr. Chinmay Shah sir. And faculty dean of MKD University, respected Dr. Hita Mehta. So this is well-known and reputed senior persons from university to college to the hospital level. They are managing, and they are our authorities and helping a lot with the good support of them. Of course, the district health team like CDHO sir, RCHO madam, MOH sir, RDD sir is also, we had a good collaboration with them. But these are important people. Someday you will come across, or you have a chance to meet any of them. These are the helpline numbers. My all three numbers. You can note it down. Probably few people have one or two, right? So note it down. I am approachable 24/7 in all these numbers. Nagrik Suvidha number of 30 hospital is here. You can also add the number of medical college. 0278 is the code of Bhavnagar. 2511 is number of our medical college. NICU, we have separate number for referral systems. We will be added in the part of group. So you will also have an opportunity to learn the proper referral system. That is also unique for our department of Bhavnagar. Right? So this is all about basic orientation regarding the Department of Pediatrics, Government Medical College, Sarati Hospital, Bhavnagar, Gujarat. So for this